What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Sergeant and Mrs. Smith, you are going to love this house.
Is that a tub in the kitchen?
There's no field manual for finding the right home. But when you do, USAA Homeowners Insurance can help protect it the right way. Restrictions apply.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
I'm reading a book about anti-gravity. It's impossible to put down. Why did the art collector buy an old septic tank? It's filled with mass turd pieces. What do you give a basketball player who never washes their jersey? A fragrant foul.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred, the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347
Poohead.
Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Please don't forget stuff.drsteve.com, stuff.drsteve.com. Use it whenever you're going to use Amazon. You just click through to Amazon, or you can scroll down, and the new mugs are available, and they are awesome, and there are just a few of them left. And you can get those there as well. Yes, Tacie.
So are Stacy, Lydia, and I here or not?
You are here. Yes.
Oh.
Is this an existential
We were not
question?
acknowledged.
Well, I hadn't got there yet.
Okay.
Oh, for fuck's sake. Yeah.
You were digging a ditch,
You acknowledged him. I'm just wondering.
Yeah, you're right. I got all excited about selling stuff on Amazon.
I like
anyway,
being a wallflower.
You know, ladies and gentlemen, Tacie.
Yay. I'm here, everyone.
Ladies and gentlemen, PA Lydia.
Yay.
Ladies and gentlemen, Stacy Deloach.
Oh, man. Bless it. Bless it. Bless it.
Yeah, don't forget to go to tweakedaudio.com, offer code FLUID for 33% off. Check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And Tacie and I have a Patreon where you can hear more of her giving me shit on patreon.com/weirdmedicine. No, it was appropriate. It's always appropriate. You are right 100% of the time. And I'm not even
Yes,
kidding.
I know that.
It really is true. Patreon.com/weirdmedicine. No, she wanted to have kids. That was the right thing to do. I never would have had kids. We wouldn't have bought the house where we bought it. We wouldn't have remodeled it. We wouldn't have done, and most of it, I would just be sitting in a basement, with my Commodore 64 and my ham radio stuff, jerking it to God knows what at that point.
Oh, my Lord.
Yeah, if it weren't for Tacie.
Vision.
Nice.
Yeah, so thank you. I appreciate it.
Good
You're
job.
welcome.
Good job, Tacie.
Yeah, she did good. And check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. Anything going on there?
Yeah, I got lots of nasal sprays going there.
Yeah.
CBD nasal sprays.
Yeah,
Good for you.
Are they good for you? Can you say that?
I can.
Oh, okay.
As long as I don't say we don't cure any disease, we don't.
But you can say it's good for you. You can do that.
You can.
Really?
Yes, you can.
Interesting.
As long as you're not allergic to any ingredients, of course.
All right. And we got a cameo to do as soon as this is over, and we're all going to do it. Okay? Because it was a 24-hour cameo. It may have already expired.
Oh no, Steve!
Let me look and see.
We're missing out on $5 here.
No, it was $462. I think. Let me see.
Yeah, split 5 ways.
Oh, did I miss it? Hang on. Anyway, we're going to do that right after these words, but right after we finish the show. You got anything else to plug, Dr. Scott?
No, sir.
Everybody good? Check out Dr. Scott's website at simplyherbals.net.
Yes.
Delightful simplyherbals.net. If they order now, can they still get something for the holidays, Dr. Scott?
I think. No, I don't think so.
This is not an ad. Okay,
Yeah,
so no. So this is not an ad, therefore. So there you go.
Exactly.
Just check out simplyherbals.net. We do have a birthday to announce, Tacie. And see, she was supposed to go, no, it ain't. But no, it's actually was Stacey's birthday. So there you go. So we actually had a real birthday instead of a fake one.
It's probably still fake. Okay.
And it's Cardiff Electric's birthday.
No,
too.
it's not.
Oh, yeah, there you go.
No, actually it is this time. Really is.
No, it's not.
This
No.
time, okay, well, a broken clock is right twice a year, right?
a year.
And so
Well,
twice a year it
a
actually
day.
is Cardiff Electric's birthday.
And you're a big fat liar.
All right. Let's see here. So, okay, well, we're good. Well, we got a phone call. Well, this next phone call is important, and they're going to be mad at what I'm getting ready to do. But I almost died this morning. It was bad. Yes. And this is what happened. I've counseled people don't eat a lot of carbohydrates before you go to bed if you have reflux, because people get that mechanical reflux. They get the sour brash. And what I'm talking about is, gravity will hold your stomach contents mostly in your stomach when you're upright. But when you're laying down flat, your esophagus is now level, and if your stomach has a bad valve in it, which we call the lower esophageal sphincter, it will open up sometimes when you're laying down there, and then stomach contents will just flood into your esophagus. Well, what else is connected to the esophagus up at the top is your trachea and epiglottis, and it can just flood in there. And then you just get hydrochloric acid flooding into your lungs. Yeah, and it's called aspiration. That's right. And so I aspirated last night, and I've done it before, and it was because I ate a bunch of stupid. I got a craving for chocolate, and I assuaged that craving by eating, half a bag of Mr. Goodbar, the little tiny ones, and didn't even think about it. Because when this happened, the whole time I'm like, why is this happening? But that was what it was, and I ate those late at night, and I overindulged big time. So anyway, it's happened to me before. I get up and you kind of choke it down, and then maybe take a
drink of water.
Yeah, drink of water.
Yeah, a shot of mustard.
Or a shot of mustard.
Something.
or some, antacid stuff.
Like a liquid
anyway,
acid.
it wasn't having it this time. So I get up, I run downstairs because I don't want to wake Tacie up, because the last time I had a medical emergency was when I broke my foot and I was going, whoa, 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 and I heard from Tacie, can you be quiet over there? So can you stop breathing? So I run downstairs and, well, hell, the dogs come with me because it's 6:30 in the morning. They think it's time to
get up,
go potty,
to go outside. So I let them out, but this whole time I can't breathe. Some reflex is causing me to swallow continually, and then my breathing is like this, which we call.
It makes me sound like Strider.
Strider,
breathing,
yes,
yeah.
very good. Okay, there you go.
Give yourself a bill.
Yes, it was Strider. So I had Strider, and I have Strider.
Oh, no. Yeah.
And so I real quick, and now this whole time I can't breathe, right? I mean, I can breathe, but it's very difficult. And there's acid in there, and I'm going, and I'm getting out. But the dogs need to be fed, so I fed I got their dog food out. I let them back in, and I got out some baking soda because I didn't have any Mylan or anything. I got some baking soda, threw it in some water, tried to chug it down, but I was compulsively swallowing because there's some reflex in my neck that's causing it to spasm.
That's right, yeah.
And then I was afraid I was going to aspirate it. And then I'm like, I'm going to puke. If I puke, I will die, because that will be the end. I have very little airway left. And I started feeling faint. And I said, because I couldn't breathe.
Did you call 911?
No. So I know I'm an idiot.
That makes too much sense.
But I knew if Tacie saw me, she would have called the ambulance. But I knew what I was dealing with. But I'd never had it this bad where my trachea was, the muscles around the epiglottis were just closing down. Because it's like, don't put any more of this stuff in here. But it's like, wait a minute, but you're killing me. Just open up a little bit. So I bent over the sink, and then I was just sort of saying, okay, call, Patrice O'Neill, I was channeling him. Calmo. Yes, very good, Tacie. You get one of these.
Give yourself a bill.
And I was calmo, and I was, but I was getting air in, and after about 10 minutes of this, it finally just calmed down. But I knew if I fainted, she would find me on the floor dead.
I bet your blood pressure was up.
I didn't check it out. This is the weird thing. So this is what I want to talk about. Not so much that. And for people out there, this is going to sound familiar to a very small subset of people in our audience. And I'm going to tell you how to prevent it, because I'm an idiot. This is the first time it's happened to me in years, because I just, I got cocky. But the weird thing was, when I had that scare where I saw my CT scan and they had this big mass, and it turned out that it was scarring from COVID.
He's just half dead.
No. No, that's not the point.
What am I going to do?
I had two sort of scares this year. This one and that one, and this both times, if somebody's mad at me at the hospital or something, if I think that I'll get my adrenaline will get going. I won't be able to think about anything until I get it taken care of, try to fix it and all that kind of stuff. Or if Tacie's mad at me, that kind of stuff. When these two things happen, nothing. I was just like, well, I guess this may be my time. Is this my time? I guess this is my time.
So comforting for you.
It was weird.
The road, yeah.
Yeah, I figured I'd freak the F out, but now I just, I was like, okay, this might be it.
I think it's worth explaining the difference between mechanical reflux and just regular reflux.
I think so too. Why don't you do that?
No. I said, why don't you do that?
No, you didn't.
I meant to say. That's what I meant to say.
So what we mean to say is different than what we say sometimes. That's
what?
Good. That's good to know.
See, okay, my job is to be the idiot on the show and to not know anything and to ask questions. That's what you've told me.
Don't antagonize her.
Not my point.
She will kick your ass.
Because sometimes I mean to say something, but I say it the wrong way, and so I'm just making sure that we
and our tone
around that.
Our tone is also something.
That's right. I have resting bitchy voice, and somebody has
does.
resting bitchy face.
Oh.
So it's like, well, you've said it yourself. And it's like, why are you looking at me like that? And you're like,
God,
no, I'm
Tacie,
fine.
look at the time.
Hey, Scott. Doing good over there?
Okay,
So anyway.
appreciate y'all.
I do have resting bitchy voice for real, though. I really
It's
do.
all the Botox. I mean, nothing moves. You know what I mean?
Yeah. But I will. I'll say, Tacie, why did you look at me that way? She's like, I'm not thinking about anything. It's just the way my face looks. So.
This is my face.
But I do that with my voice, too. You know. But anyway, so.
Here, I'm going to circle this back around because I've had the same type of reflux.
Yes.
And what I've learned to do is as fast as I can to flip over in the middle of the night.
Yeah.
Get on my knees and put my head down, as low as I can to try to get that gravity to keep that stuff out of the esophagus.
Right.
It tastes horrible in your mouth.
Oh, it's awful.
And just slowly, just the most tiny little breaths at a time.
Right.
And then belch for the next 30 minutes because I fill my stomach up with
That's
air.
what I found, too, is that I had filled my stomach up with air, and that's what forced it in there. And I think my BiPAP might have had something to do with it. But that's a good technique. I want people to never have this, though.
Yeah, sure.
So preventing it is really the key. And Tacie's right. We hear about gastroesophageal reflux. That's where people have heartburn and stuff. Mechanical reflux is when you've got fluid in your stomach, and then the lower esophageal sphincter just opens up, and it just comes flooding up into your esophagus like that, and causing aspiration. So I want people to be able to avoid that. If you're listening to me, and this is something that happens to you, do two things. Do several things, but one thing that I have never done that I probably should do. And one of those is the most important, is no simple carbohydrates within 4 to 6 hours of when you go to bed. And what I'm talking about is bread, cake, dessert, sugar, that kind of stuff. Low carb. You don't have to do a low carb diet, but just do lower carbohydrates before bedtime. And if you're eating cereal and shit right before you go to bed, like we did when we were kids, when we had a nice tight lower esophageal sphincter, that may be part of the problem. Okay, so. The other, I know that sounded hot. Nice, tight lower esophageal. Oh, yeah. Your lower esophageal sphincter is so tight.
What's the mechanism there? Is it the direct action of
I do not know if
Okay.
it's turning, it's becoming more acidic as those carbohydrates are reduced to sugars and then sugar alcohols. I don't know the answer to that.
Indian food would do it to me. When I would travel, I would always eat Indian food at night.
Would you eat the rice with it?
Yes.
Yeah, that could be it. That could be it.
But I would also order it Indian hot.
And alcohol, too. Well, it can do it. Well,
Yeah, alcohol.
So if you drink a lot of alcohol and eat a lot of carbs and then go to bed, you're at higher risk of this happening. So avoid that. And then, so a couple of things. If you are prone to this, take a couple of bricks, put them under the head of your bed. Yep. Just because if you prop yourself up, which some people do, they'll get what they call a husband pillow, that thing that's got the two arms on it, and they'll sleep on that propped up. If you're obese at all, what's going to happen is that your abdomen is going to push in on your stomach. When you're bent like that, it's actually going to make the problem worse.
It pinches and pushes it up. Yeah.
Right, it will force it up. So you want to be flat, but at an incline. So if you have one of those beds that'll do that and you're highfalutin, I think that's great. But if you can't, you can just take a couple of bricks under there. You won't end up falling, rolling down the bed if you don't do it too high. But gravity will be your friend, and it will keep stomach contents in your stomach. The other thing is you want to get the pH up a little bit in your stomach. So take an antacid before you go to bed. There is a medication called metoclopramide, which I do not recommend people take on and on and on and on. But if you're having several episode, that can help. But there's surgery that you can do called fundoplication, and that's where they just basically go down there and make you a new lower esophageal sphincter, and that will stop. If it's happening to you every night, you may be a candidate for that, but see a gastroenterologist or a surgeon. Tacie, you wanted to say something about this.
Okay, I might be the historian of the show here, but I remember something about taking a T-shirt and sewing a tennis ball pocket in the back.
Okay, yes. So that was for snoring. That was for people who have positional snoring. If laying on your back, but that's not a bad idea. I'll give you a half a bell for that. Okay. Give you a half a bell because that was for snoring. But if it always happens when you're laying on your back and never happens when you're laying on your side, then yes, having someone sew a pocket into the back of a T-shirt, wearing the T-shirt, and then stuffing a tennis ball in there will keep you off of your back at night. Mm-hmm. And so that was really for positional snoring. But yeah, for if the reflux is there, that could be it. Were you going to say something else, P.A. Lydia? So I take medication to raise the pH of my stomach, which does increase my risk of some certain other things. But this could have been a lot worse if I had pH 3 hydrochloric acid in my stomach. So I probably had pH 5.
It does rekindle general chemistry.
Yes.
So the professor one day was on a stomach acid rant, right? And we know the pH of hydrochloric acid is quite low.
Yes.
What is it, like 2?
Yeah, something like that. I don't know.
So he was thinking, you know what happens when we mix a base with an acid? You have a heat reaction.
Yeah.
So his argument was to drink something of a weaker acid like a Coca-Cola. But I've never attempted that.
Well, Dr. Scott uses a weaker acid in yellow mustard.
Yeah.
Okay. Yeah. So that makes sense then.
It does work, yeah.
So it is interesting that people, and we did it here on the show one time. I was trying to get off PPIs, proton pump inhibitors, and I had horrible reflux, and he brought some mustard in, and I'll be damned if it didn't work. Although we thought maybe it was the turmeric that was in it. Well, we don't know. But yellow mustard has an acid pH, so it doesn't make sense. We have people saying they use apple cider vinegar for it. But to me, that makes way less sense than using a base and then just neutralizing the acid.
Sure.
From a pH.
I keep it in my shaving kit.
Yeah, from a pH
just a little packs.
Chemistry standpoint, you remember we used to do titrations and stuff. It was fun, and you would watch the solution change from red to blue, and it just take it. Now, what it does, it is slightly heat producing, but there's so much fluid in there that's not a big deal. It dissipates quickly. What it really does, though, is it produces gas. And you start belching and stuff. And actually, I knew I was getting better when I could actually finally eructate, which is the medical term for belching. We have to have a different word for everything. Eructate army.
Just to show off.
Yeah.
Just to show off.
Coke floats in my cup. Eructate army.
Eructate army. I thought you were going to start talking about the other sphincter muscle.
Ooh.
No, and come on, we like
the upper esophageal sphincter.
Yeah.
Okay, playing off of that, can I ask you?
Yeah, of course.
Bend off into another question?
Yeah.
Vomiting.
Yes. AKA vomiting in our area. Yes.
Okay, the puke. Yep. What is involved muscular-wise? Because that has got to be a violent muscular reaction.
It is. Yeah, it is. Absolutely.
It's got to be one of the most violent things that ever happens in your body.
And I hate it. I hate to puke. I'm what they call an emetophobe. So, P.A. Lydia, you want to take on the anatomy of vomiting?
I'm just imagining our stomach contractions first, but I was trying to figure out the remember the nervous innervation there. It's not the, is it
vagus.
the phrenic? Vagus nerve,
yeah. And phrenic nerve
and then
would be involved, yeah.
Yeah. So you get the contractions through like the stomach, but also surrounding the esophagus, right?
Yep.
You take it,
so you get reverse, so peristalsis is the contraction of rhythmic. Very good. Yeah. Thank you, Dr. Scott.
Give yourself a bill.
That's a bill.
Yeah.
1 to 1.
You got 3/4 of a bill on that one. And
damn it.
So you have rhythmic contraction going toward the anus, basically, and you can reverse that
one way only, hopefully.
Yeah. And so the diaphragm, and then your intercostal muscles, too, which are the muscles between the ribs that are supposed to, they are called the accessory muscles of respiration. They contract. And, when you shouldn't need those very often. You use those when you're long distance running and stuff, when you need a little extra oomph to that diaphragmatic movement. And so the intercostal muscles. So you'll get the contraction of your rib cage, which can become painful after you've done this a few times. I remember the last time I had a puke bug, the first couple of times I puked, it was like, yeah, I was sucked, but it felt better. And then like the 14th time, you're like, oh my God, come on, please. And their muscles are all just completely ruined, and you're out of energy and stuff. It's awful. So, but anyway. Yeah, but that's basically it. Okay. And it's a reflex it's very complex. Reflex starts in the center of the brain. So anyway, all right.
Let's go to that important question.
Well, okay, so we will, but I do want to tell you a story. Our son got in a car wreck, right? And he just rear-ended somebody. She was starting on the exit ramp and then got all scared and slammed on her brakes right at the top of the exit ramp. And of course, at that point, he had seen her accelerating away, and he's looking to the left to see if anybody's coming, and he ran right into her. I've done this. That's a very easy thing to have happen. And but he got a ticket for it because he's 19, and she was the whole time going, "It's my fault. It's my fault. I got scared," and all this stuff. But anyway, if you hit somebody from behind,
it's always you.
It's always you.
Unless they're in reverse.
No, it's
unless they're in reverse. Very good.
It happened to me one time.
Oh, is that right?
It was my fault, but it ended up being their fault because
they were going in reverse.
Yeah.
Okay, that's a good thing to. She was going in reverse, Your Honor.
They're like, touche. Yeah. You are correct.
Yeah, that's hilarious. Okay, everybody remember that. Yes. If you learn nothing from this other than that. So anyway, so he's in driving school. Well, they do it remotely. So they sent the Zoom link, and I was just going to set it up for him. And by the way, this was not too long after I had my near-death experience.
So it's today?
Yeah, it's today.
Oh, wow. Okay.
So I still had my nasal strip on. I was in my robe. My hair looked like Einstein. And so I bring up the Zoom link, and there's everybody. The teachers there, everybody, and it says my son's name, Liam so-and-so at the bottom. And here I am looking like some lunatic from The Haunting of Hill House. And so I was just like, I'm going to driving school, y'all. Just embarrassing the shit out of him. And he reached over, he was like, God. Damn it, Dad. And he clicked on the camera to show it.
Love it. Love it.
That's good stuff.
Praise, and my voice is all messed up, so I used it to my advantage. Praise the Lord, I'm going to go to driving school.
Oh, my God. That's nice. I had to do driving school in person.
Oh, yeah.
I did too, 8 hours.
Whoa.
It's only like 3 now.
Wait, 8 hours? Did you
that
have a
was
DUI?
back when we lived in Rogersville, yes.
You had a DUI?
No.
I think it's just
that's
girls
just what
need
it
more.
was.
I think girls need more driving.
Oh, yeah.
Oh, is that what it is, Scott?
Mm-hmm.
That's just what it was back then. In Virginia. It was in Virginia, so it may be.
Oh, yeah. That could be.
Yeah.
That could be.
Oh, there's a. I know. Okay, so this person. Anyway, this is the last show. We'll do this because of this person. Hang on here. Hang on.
I love it.
All right.
Hey, Dr. Steve.
Hey, man.
I love you. Great shows.
Thanks.
I've noticed, though, in the past few months that, your shows are trending more towards the social hour. See who can bring in the grossest piece of medicine.
Give yourself a bill!
Fine, but long-time listener, I really miss when you and Dr. Scott and Tacie just
answered
medical questions.
I got you.
We hear that a lot.
Backlog on. So,
okay.
He's got a point. He's got a point.
So,
Fair.
Is there any chance we can get back to
Yes. But here's the thing. So we've done shows where I've said, we're doing too much social stuff or just bullshitting.
Yeah.
And I used to have even the I don't even know where it is now, the drop that said, can you please stop bullshitting and answer the questions? But then I'll have people say, no, we like that other thing. So Here's why. I'm going to tell you why this happened because this is important, and I appreciate the question and the constructive criticism. I really do. It's because of my job, and so we were recording on Wednesdays, and I work an hour away up a mountain in a very busy location, so I have to get there really, really early, and then work all the way through lunch, and then try to jump in the car at 3 to get here by 4. And a lot of times it doesn't happen. Or if I do, I'm getting here 5 minutes before the show. So there's no show prep. And I know, okay, we'll do it the day before. Okay, when? So now we're recording on Saturdays. So we got it all out of our systems today. And hopefully next show we'll do more questions. So I want to do more questions. I've got a backlog of thousands of questions. I think the next thing he says is, well, you keep saying you got a backlog.
That made the show, just get caught up and
Get caught.
We will never get caught up.
Imagine being caught up in life.
Yeah.
Yeah. That's social.
Well, you get caught up, and then immediately things just keep progressing.
You get caught up in one thing, everything else is gone.
But I appreciate the
been a long time. Been a long time.
And I like the shows where we just answer a bunch of questions. Actually, the last few we've done a lot of that.
Yeah, I've been
especially when
close,
Lydia isn't here because it's Lydia's fault.
Yeah, Lydia.
Anyway,
damn it.
All right.
Speaking of questions, we do have one from the chat room,
and those count.
Yeah, buddy.
Hang on.
Let me do that. Gives the disclaimer.
Number one thing: don't take advice from some asshole on the radio.
All right. Thank you, Ronnie B.
Yeah, thank you, Ronnie B. Stephen wants to know. He's got a quick question. His wife has been battling vertigo for the past week and a half. It's been slowly getting better. Originally tried the Epley maneuver, but it did not help.
There you go.
So, but it didn't help.
It did not help.
Did not help, yeah. So,
right. So
a couple suggestions.
You want to talk about the Epley maneuver first so that people know what the hell you're talking about?
Well, you lay
and
back.
When it would help, but then I know why it didn't help.
Well, I was going to say, I think I know why it didn't help, too.
Okay.
Yeah, if so, you do have crystals inside your ear, inside those semicircular canals where the balance occurs. And sometimes when they get to moving around, they stimulate those little hairs inside there and can give people vertigo.
Yep.
And if they get misplaced, one of the ways that, and physical therapists are really good at doing is helping people do this Epley maneuver, especially
ear, nose, and throat physical therapy. Or you can just look on YouTube. Just learn how to do it yourself.
Yeah, but I think sometimes the first time you do it, it might be a little bit easier if you've got some adult supervision.
Don't disagree.
But again, look it up on YouTube. But the bottom line is you turn your head, you lean back, turn your head to the side.
Yeah. You do a bunch of different maneuvers and stuff.
And hopefully move those crystals back to where they're supposed to be.
That's right.
Yeah, and if that does not do it, though, there are some other things that can cause vertigo.
Well, that's right.
Yeah.
So you want to talk about it? Let's see. I got my finger on the bell.
My first guess is, since it is getting a little bit better, sinuses. Bingo. Oh, well, hell no.
No. What could have caused the sinus problem?
Sinus
what could have
inflammation.
been the original insult, though?
And, well, I mean, they could have had the COVID.
Okay. No.
A sinus inflammation or sinus infection can cause vertigo.
Mm-hmm. Okay,
sure
but that's the most common thing is a viral labyrinthitis, where you just get a virus that could end up causing a sinus infection.
Sure. Or inflammation,
inflammation in that area. But viral labyrinthitis, and those are the ones where you get vertigo and it lasts about maybe a week or 2 weeks, and it usually responds to over-the-counter
anti-inflammatories or
anti-vertigo agents.
Oh, yeah.
Like antihistamines, like meclizine is the classic one that we prescribe. But anyway, and you can buy it over the counter now.
Well, you can, and certainly we have allergy medicines sometimes can help with vertigo. But other things,
anything that and Scott's right. Anything that causes inflammation in that area can do it. But the number one cause is a viral labyrinthitis. Okay. Now, if it doesn't go away and the Epley maneuver doesn't work, then you have to go see an ENT, and they deal with all the dizzy people.
Yeah, and now I do see some that get like an occipital neuritis. So people the base.
Explain what that is.
The base of the skull,
Mr. Jargon.
Well, but people, nerves coming out of your cervical spine, the upper neck, and going into the base of your skull. And sometimes those will get inflamed, especially if you're tense or cold, or even sometimes you can get trauma back there. And we'll stick needles into those nerves in the base of the skull, the occiput, where you know, right to the base of where your hairline is. We'll put needles in there, and pain medicine guys, and even you, I know you guys probably do the same thing. Sometimes put like a little steroid or a little.
I won't do that for vertigo. Yeah. I'm not hitting up a cranial nerve for vertigo.
That's easy. You can do it. You can do it.
Thank you.
You've got the skill set, Dr. Steve. We'll send him to Lydia. Lydia will do it.
I just don't think it'll work.
Oh, no. Hey, no, I've had it work. I swear. Hey, last time I had vertigo was awful. Well, and that's what I had. Yeah, it's awful. And it was so bad. I'll never forget. I went home, and I was just exhausted. I threw some laundry in my washing machine and turned it on.
Yeah.
And it had a leak. Water's pouring out of the bottom of my washing machine, and I was so sick.
Yeah.
All I could do was push stop.
Yeah.
I went in and sat down on my couch with my laptop and ordered a washer and dryer from Lowe's. That's God's honest truth. It was delivered the next day.
That's hilarious.
Because normally, you know me, I would have gotten down there and fixed it, but I was like, oh,
I'm going to throw this out there for people too. Nobody asked this question, but if you use rubber hoses in your laundry room going between... Get rid of them and get the ones that are clad with metal.
Yeah.
And every plumber I've ever talked to has said that, because if you use the rubber ones, eventually what happened to Scott's going to happen.
And even worse are the ones...
It's under high pressure because it's always on.
Yeah, and even worse are the ones that are ribbed.
Yeah.
Because those have like weak spots. I mean, where they bend and those suckers.
They are ribbed for your pleasure, but they're not pleasurable when they burst.
Oh, man.
All right.
Thankfully, that's the last time I had that. Because I did everything. I tried the epi and I tried the sinus stuff. And I finally wound up just getting a shot in my neck.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success, and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
All right. Now, we may have some disagreement on this next one.
Okay.
All right. You ready?
Hey, Dr. Steve, it's Mike up in New York.
Hey, Mike.
I was watching TV, and they have a lot of ads for this copper-infused stuff you put on for plantar fasciitis or knee pain, elbow pain, all that garbage. Any truth to that, or is it all just, a money-making scam?
Okay, so I'm not going to talk about any specific brands or anything. We're just going to talk about the science itself, and because I don't want to, and as always, make your own judgments on these things that you can buy over the counter. Dr. Scott, what do you think? Copper-infused fabric that you put on the skin for arthritis and plantar fasciitis and stuff like that.
I do not know the science behind them. I personally like them, but I don't know the science. So
okay,
that's all I'm saying.
All right, that's fair enough.
But I'm not saying they're good or they.
You like them personally,
but I personally
right.
like them. Right.
So here's were you going to say something, Tacie?
Well, are they made differently? Like, are they tighter around?
Now she's got.
Or do you really think it's the copper?
I don't know. I think the copper.
What about a copper bracelet?
Well, and here's
now we'll tease out the bullshit detector here. Copper bracelets and magnetic bracelets for arthritis. What do you think?
No.
Okay, very good. I'll give you that.
Give yourself a bill.
Yeah. And it's not my opinion. Yeah. They have that is very easy to do a double-blind, placebo-controlled study on. Think of how you would do it. How would we determine whether a copper bracelet or a magnetic bracelet would help anything? PA Lydia? Oh, she's
I'm reading about the anti-inflammatory impacts of copper on rats.
Yes, but that's not on their skin, though.
Yeah,
I looked at those studies too.
So, how would we design a study to see if a bracelet works?
Yeah, copper bracelet particularly.
So you pick X number of X number of subjects.
Okay.
Half of them get a bracelet, right? Mm-hmm. Or however many you decide for the powered study. A certain number get a bracelet. A certain number do not, and then they should rate their pain.
How would we do a placebo in a situation like this?
Oh, yeah. So just like some type of, you couldn't really do a non-copper metal because then you would wonder whether the other metal had a similar.
Well, you'd have to, you're right, you'd have to correct for that.
Yeah.
So, I would.
A copper-looking bracelet. Yes.
I would, and if they say it has to come in contact, so this is your hypothesis. Because if I enclosed the copper bracelet in a plastic thing and gave some people the plastic thing with no copper bracelet in it, or a similarly weighted, piece of lead or something, and then the other one, then the people who are promoting this would say, well, no, it's got to come in contact with the skin. But that would be one way to do it to see if just the presence of copper would have some effect. Now, then yes, you would have to be very clever on figuring out a way to make a placebo that people would believe. Now, you don't have to tell them, we are doing copper bracelets. We are doing this therapeutic bracelet, so the other one could look similar but not have to look just like copper.
Yeah, that's a good idea.
Yeah. And you don't have to disclose exactly what the end point is and still be ethical. Okay.
Yep.
And, when you're placebo in itself is you're deceiving somebody. So, but anyway, so there's a study here that looked at 65 participants, provided complete self-report outcome data for all devices. So what they had was 4 different devices, a standard magnetic wrist strap, a demagnetized wrist strap. Now that's a good one because it's really easy to to make a magnet look, or a not magnet look like a magnet. Problem is, magnet's still going to stick to stuff, but these things are so lowly magnetized that for the most part they might not notice. Okay. And then they had an attenuated magnetic wrist strap, and then they had a copper bracelet. And the devices were each worn for 5 weeks with people who had painful rheumatoid arthritis. And they did a visual analog scale, which is on a scale of, in this case, 1 to 100. Where would your pain be? And they would rate it over time. And the result was 65 people provided this data, and 4 people provided partial data. but there was no statistically significant differences between the 4 devices, and the p-value of the null hypothesis, in other words, the statistical significance of the negative effect was highly significant, was 0.05. So it was 5 sigma. That's our 5 times out of 100 that could happen by chance.
Right.
So their conclusion was wearing a magnetic wrist strap or copper bracelet did not appear to have any meaningful therapeutic effect beyond that of a placebo for alleviating symptoms and combating disease activity in rheumatoid arthritis. So there you go.
Hey, may I make one
Yes,
other
of course.
question? And I don't know. Again, those the slip-on ones with copper in them, whatever they are.
Oh, okay.
I'm thinking part of it may just be because it's warm. Maybe
Yes.
copper makes it maybe warmer. I don't know.
So what I did
Maybe
find,
so.
there is some benefit,
Is it-
and Tacie really was on it, and she'll get like a quarter of a bell.
Damn it, you got part of my bill.
Because they are made differently and they're tight, and so
Okay.
compression itself can be therapeutic.
Yeah.
And the other thing about copper-infused fabrics is that it is antibacterial. So that is very well confirmed. So that's sort of interesting.
So there's some data though, just from my quick searching here. Sorry, I can't hear anything now. About the anti-inflammatory effects of copper, right? And so we know if we put anti-inflammatories on the skin, like proven anti-inflammatories like NSAIDs, right, that you do get some absorption
So what's the
to
difference?
the local.
What's the difference? So the copper anti-inflammatory stuff that you were looking at, because I looked at the same studies, I'm sure those same rat studies, that wasn't topical.
It was not topical.
So, and you're right, you can put drugs on the skin, and if they have the right properties, they will, get into the blood supply. What's the difference?
No.
The copper bracelets aren't, the copper isn't being absorbed into the skin. That's the difference.
Sure.
So but you are right. There's something there. And we do use copper for things. And there are cupric, things that in medicine, I'm sure there's something there.
Yeah. And you do have to have
micronutrients.
something to stimulate the absorption.
Yes,
right?
that's right. So yeah, you could put acid on it, and
then put a copper. No, don't take any of this advice.
No. I'm just saying that would be experimental. You would dip it in sulfuric acid, and then strap it to their skin. And go, how's your inflammation now?
Can't even feel that painful knee.
Take your mind off of it.
That's right.
So you should have put it in the corner of your mouth this morning when you were having all that acid reflux?
No, I should. Can
That
you
would've been
imagine?
good.
That would have been great.
Stick a battery in there, buddy.
Now, our buddy Logan Field had a follow-up to a problem. Now, Logan Field has been here in the studio. He was at one time a member of Super Android 23, the electronic band that you can hear on Spotify.
Another
not Spotify.
nerd adventure.
Not Spotify. SoundCloud. SoundCloud.com/weirdmedicine, I think. It's all very embarrassing.
Yes.
So,
Yes,
anyway.
as it should be.
Hey, Dr. Steve, this is Logan.
But he's
back
a good
again.
one.
I had a follow-up question regarding the pineal gland question I had for you previously regarding the calcification. And
okay, so his question was, does fluoride in municipal water cause calcification of the pineal gland? And the research that we did seemed to show that there was no connection between the two.
the fluoride in the water, a lot of people, again, believe that causes calcification of the pineal gland.
Yeah, a lot of people believe a lot of stuff. It's faith-based. It's, we're interested in science, so we couldn't find a correlation between the two things. But you're right. There are a lot of people do believe that. And all I can do is say, here's what the data shows. And how could we study it that would satisfy you, And sometimes there is no study that you could do that satisfies somebody because that's just their belief system, and that's okay. That's, it's a free country.
My question to you is, could you go into a little bit about what the pineal gland actually does, and if your pineal gland does become calcified, is there a way to turn that around and decalcify it? I'm reading a lot about this stuff online. It's really interesting.
You stop reading stuff online, unless it's a journal. You go to PubMed.org or find a legit medical website. And then I'm okay with the fringe stuff because that's where some really interesting stuff comes from. Remember, Tacie, we used to know a gastroenterologist that said that there's no way in hell a bacterium can cause ulcers in the stomach.
Well, I believe that was most GIs.
Well, I mean, we knew personally one that would yell at me when I brought it up. Probably yelled at you a couple of times.
Oh, I got yelled at all the time.
But it's and now we know Helicobacter pylori causes stomach ulcers, and we test for it every single time that we do an endoscopy, and we treat for it when we see it. So it's a real deal. So that was fringe AF at one point. Giving beta blockers for congestive heart failure was malpractice when I was training, when I went to medical school.
Really?
Yep.
How crazy.
Yeah, and now it's malpractice if you don't do it.
When I started, I was always when I started working, I was fighting with physicians as to whether a PPI was better than an H2.
Right.
There's no physician out there now that would say...
Right, they all write.
Yeah.
PPIs.
Mm-hmm.
Well, one of the problems with the H2, and so H2s are the medications like ranitidine, which is no longer on the market, famotidine, a.k.a. Pepsid, those kinds of drugs. No, not Tagamet. Tagamet. Cimetidine.
At the time,
yeah. Tagamet or cimetidine. And then the proton pump inhibitors are the things like lansoprazole, a.k.a. Prevacid, or dexlansoprazole, a.k.a. Dexilant, those kinds of things. And or omeprazole, that was the first one, which was Prilosec.
Okay.
And they have completely different mechanisms. The reason that the H2s have fallen out of favor is because of a phenomenon called tachyphylaxis, which is where the effect wears off really quickly. And if you start taking famotidine every day, you may notice it's not working as well as it used to. But the PPIs continue to work as time goes on. But anyway, so let's go back.
But you need to go see your doctor anyway.
And please do that.
Mm-hmm.
When they first came out with this stuff on the over the counter, we were all kind of freaking out a little bit. Yeah. But
because it says you should only take them for 14 days.
And then people take them forever.
And because it works. And
they may be missing things. But anyway, so this guy's, Logan Field's calling about the pineal gland. So does anybody want to take this on what the pineal gland is? Because I'm happy to do it.
Well, I know it produces melatonin. Right?
Okay. Yep, and you should know that so they get that much of a bell.
Now he's not giving the whole.
It's a tiny pine cone-shaped gland in the middle, center, lower part of the brain, right between the two ventricles.
So you're looking at the same website I am.
No, I'm not. I'm actually not.
Okay.
But I don't know anything about the classification of it.
Right. Okay. So
what's up?
So here's the thing: is PA Lydia got it exactly right.
Give yourself a bill.
It's a little pine cone shaped gland, but it's about the size of a grain of rice, though. It's really small. You think of these things as being huge, but your brain is
not really.
I mean, look at how big your skull is, and there's a bunch of meat between
and fluid.
Right, but there's more. Yeah. Like you think, oh gosh, my skull is right under there. No, it feels like it is, but when you cut into it, it's a good half of an inch.
Yeah.
And some people, it's more than that, which is weird because if you feel it, it feels like your skull is right under the skin.
Yeah.
Doesn't it?
There's some muscle there, huh?
Yeah, but there's muscle, there's
soft tissue.
Right, there's fat, there's
Fascia.
some people more than others. Yeah. Anyway, but so the pineal gland is a little tiny gland, and we don't know what the hell it does. It has obviously something to do with sleep. It may have some input on decision making, which is sort of interesting, and how you perceive reality. Mm-hmm. So you want a functioning pineal gland, which is why I was always wary about taking melatonin for a long time, because you are messing with this gland that we don't 100% understand. And we don't understand reality and messing up with our perception of reality. But so far, so good. Most people seem to be able to take melatonin without adverse effects. But this gland serves as your body's light meter. So light comes in through the eyes, and part of that signal is routed through the pineal gland, so it knows when it's daytime and when it's nighttime. And indirect sunlight really helps with that. So if you're in a cubicle, in a windowless room, that kind of messes up and those folks that are, have that sort of working environment, unlike Tacie, who's outside all the time, may have trouble sleeping.
Yeah.
And when you get calcification of this gland, that is irreversible. So that's when calcium takes over from the tissue, and that you can't get that back. So, it's surrounded by cerebrospinal. Oh, wait a minute. Hang on, because I catch shit if I don't do this. It's surrounded by cerebrospinal fluid, and it's just sitting there. Lots of other things can become calcified. Your heart valves, the aorta, other breast tissue can become calcified as well. So as you age, there's more likely to be calcium in the pineal gland, which could be one of the reasons why, as you get older, your sleep cycle gets more effed up. And but there's some babies will have calcifications. They're born with calcifications in their pineal gland, so it's not just aging. The more active it is metabolically, the higher the likelihood is that it will be calcified. But how do we modify that? We don't know yet. And then other things like certain chronic medical conditions might cause it. Chronic use of steroids and stuff like that. They don't know. We don't know enough about this gland. Nobody's pouring billions of dollars into pineal research because really the only thing we know about is melatonin. We already have that. What were you going to say, Lydia?
I'm just thinking, I think I've read brain MRIs every day for the past 7 years, excluding weekends, right?
Never seen a...
They don't... I mean, I guess if you have to ask for cellular images, and then maybe they... I mean, have you ever seen it reported?
No, I
anything?
Never have.
Never.
Maybe once.
Yeah.
Maybe once. I think it's probably so small that the slices that we do, they wouldn't see it. So you'd have to do some, really small slices. Let me do a quick PubMed search. That is a great question because you're absolutely right. I read those all the time, too. I order them a lot. You order them a lot. You're looking for, metastatic disease and stuff, so you do this every day. I'm looking for the same thing. MRI, pineal calcification. And Dr. Scott, would you look up the prevalence of pineal calcification?
Hey, Cush is in the house, by the way.
Hey, all right. Hello, my friend. Pineal gland volume assessment by MRI? Nope. Associated between pineal gland calcification and white matter hyperintensities of vascular origin in older adults. That makes sense to me, that if you've got microvascular changes in the brain that's caused by high blood pressure, where you get little tiny areas that are calcified in the brain, that the pineal gland has a blood supply. It's going to be impacted too, right?
It has to be a very tiny blood supply.
Yeah. Okay, diagnostic accuracy and susceptibility, weight magnetic resonant imaging for the evaluation of pineal gland calcification. By God, here it is.
That's what we want.
So they have to do, susceptibility weighted magnetic resonant imaging for the detection of pineal gland calcification. This is why we're not seeing this. That combining that and phase information enables the accurate detection of pineal gland calcification. Otherwise, you're not going to see it, or the sensitivity is very low. So isn't that interesting? So you would have to ask for it, and it's like, why would we ask for it?
Right.
Why don't we give? What do we give a shit about it?
Well, we've started specifically asking for cellular images for the pituitary gland.
Yes, I don't have a pituitary gland.
Really?
Yeah, I have empty cella syndrome.
Wow.
That
Isn't that weird?
I didn't know that.
How do you take artificial hormones?
Nope. No, it still works. Apparently, there's a little strip of pituitary that's still functioning.
Good.
Isn't that crazy?
Yeah. All right.
Yeah.
Weirdo.
Go fuck
How did they
yourself.
find that?
Well, they were doing an MRI for a different reason.
Incidental, right?
Mm-hmm.
Yeah, totally.
Yep.
Okay, cool.
Yeah. And I do. I do take testosterone supplement. So I'm going to take me an extra one today.
Oh,
Tacie.
good. Can't wait.
Get all hipped up on.
All hopped up on some juice.
Testosterone gel.
I just prescribed that for the first time. It took a lot of reading to figure out what I was going to do.
Oh, why didn't you call me? Yeah,
well, I should have. I was thinking about calling endocrinology. Then I chatted to the attending I work with, he's like, just pick a dose.
You know you can call me on that stuff, right?
should've.
Because we do that all the time. Let's
Okay.
throw this out there. 50% of men who are on chronic opioids or have gone through cancer treatment, and this is sometimes that's the same set of people. You know, a lot of people with stage 4 cancer will have, chronic opioids for cancer pain, will have low testosterone. And if you treat them, as long as they don't have prostate cancer, then their fatigue that you were thinking was cancer-related fatigue will actually get better.
Well, we'll see.
Yeah. So it's really about 50% of your patients. So if you're asking them, do you have fatigue? And then you test them. I always test them for CBC, which you're doing anyway, thyroid. I screen them for sleep apnea, and then I look at testosterone. And about half of them will have it, and then I just treat them.
Yeah. Well, we'll
So very
see how
good.
it goes.
All
Yeah.
right, we'll give you a.
Give yourself a bill.
Oh, she gets a whole one.
It only took me
Damn it.
10 years to do it.
Okay, well, we've got, before we wrap it up, we've got a few more questions here, and let's just go ahead and do those. Make sure that we are satisfying our friend who called in earlier. And this is a good one, though. It's a really good question.
Tacie!
No.
What's up?
Okay, strange question. Are tooth cavities contagious?
Okay, so Tacie, that is another excellent question. And anybody have anything on this? Because I do, which is pretty interesting.
I'm going to say if you have an open wound.
An open wound.
And you...
In your mouth?
In your mouth.
Yeah.
Maybe it is contagious if you're
like sharing bacteria or something. So a cavity is like what you get the degradation of the enamel, right?
Right.
By like overriding plaque that's been there for a while.
Yeah, and acids that are
Or
in your
they
mouth.
can call it a suspicious
Gum,
place and charge you $1,000 to fix it.
That's what happened at
my
Tacie.
initial thought here is
We'll
that
talk about that in a
someone could think it would be contagious if you're living in the same household and everyone has cavities, but you should really look at the environment and
that's good.
Dietary intake of the household, water intake.
I like it.
Culture of the household.
Toothbrushes
Sorry,
in the
Stacey.
household
Yeah.
or not.
What tricked me off was small children getting cavities.
Right.
In their
And
baby teeth.
Right. So I figured that was mostly sugar and bad brushing habits.
Mm-hmm.
Right. But, the precursors to cavities ride it out in the bacteria contained in saliva. And there was a study that was done that said that cavities were usually caused by sugar that builds up and decays teeth, but studies have shown cavities can be transmitted through close contact with another person, but they have to have poor oral hygiene.
Okay.
So I think what it is though there are specific cultures. Yes, Dr. Scott, very good.
Give yourself a bill.
That there are certain cultures of bacteria that grow in the mouth when you have active dental caries, and those can be transmitted from one person to the other. But really what it's doing is they're not contagious. You are accelerating a process that already started. So that's very interesting.
Good. Whoever asked that question was a great question.
Yeah.
That was a great question.
Brain
exercise.
He's a pretty smart failer.
I knew that one was coming.
Of course. I think this is one that we really need to do, and then we'll get out of here, okay?
Yep.
And
Hello, Dr. Steve.
hello.
How are you?
Oh, hello, my friend.
I'm good, thank you.
It's the Watcher.
Hello, Dr. Scott.
Howdy.
How are you?
Fabulous.
Dr. Steve.
Yes.
Recently in the news, I've heard that my favorite singer, Celine Dion, has been diagnosed with stiff person syndrome.
I saw that too.
I have 4 questions.
Four
First,
questions.
what is stiff person syndrome?
Okay. Number one, I can do.
Second, do I have it?
That's only
and
2.
C,
Oh, C.
please explain more.
That's not a question.
Thank you.
That's 3.
I will hang up and listen.
He always leaves you on a damn cliffhanger. This guy.
That's so funny.
That's Cardiff Electric, by the way, the owner of our network, and happy birthday, sir. And what he did a series where he did, and Tacie was a character in it, and I was a character in it. Well, there was a halfway house called Tacie's Place, and it was a serialized drama, right? Mm-hmm. And he gets to the penultimate episode where there's a big cliffhanger and just never did another one.
Oh, goodness.
Never did another one. So I've got 4 questions for you, and then he has 3 questions, and it's fucking up my OCD. But anyway, all right. So this is true, Tace?
Yes.
Okay.
Yes, I read it last week.
Yeah.
Wow. Okay. So yeah, stiff person syndrome. I've seen this before. Have you ever seen one, P.A.
I have
Lydia?
not. No, I'm reading about it.
Okay.
I've seen one.
Oh, yeah. You have? Mm-hmm. Yeah. It's rough. If you do this long enough, you'll see at least one. They used to call it stiff man syndrome, but of course that's not
not appropriate.
Not correct in
That was
2022. So, stiff person syndrome. It is tough to diagnose. I'll tell you that until it gets really bad. But they will have, it's an autoimmune disorder that affects a specific pathway enzyme called glutamic acid decarboxylase. And what this does is it makes a thing called, or it helps in the process of making gamma aminobutyric acid. Okay, do we know what that is, Tacie? This is something that's very important to you.
I do not.
Is GABA, because when you take something some anti-anxiety medications are what we call GABAergic, meaning that they either produce more GABA or they will stimulate the GABA receptor, and that produces anti-anxiety effects, right? So now if you affect this gamma or glutamic acid decarboxylase and you can no longer make GABA in quantity, one of the adverse effects is going to be what?
Are you talking to me?
Yes.
Oh, well, I wasn't paying attention. I'm sorry.
All right.
Yourself a bill?
You get a bell for that. I'm just going to... to me. All right, and here's my other...
Man.
I mean,
you are one pathetic loser.
That's me.
Ooh, ouch. Is that to me?
No, that was to me.
That's
because
what
you're
I
not
thought.
my wife.
That's what I thought.
Trouble.
We were just
Get him,
we were just talking about this is very important to you. And then
I just
then
totally
you're like,
blanked
I'm not
out.
paying attention.
It's all the anti-anxiety medicine.
Oh, you think that's what it is? It could be all the GABA in your system.
So much
Just
GABA.
imagine if you didn't have GABA in your system, what would happen to you?
Oh, okay.
Anybody.
It would be horrible.
Yes, it would be horrible because it would make you anxious. You would have increased anxiety because you wouldn't have your own body's version of GABA being produced. So,
or the Valium.
So, but the other thing that this does, exactly right. GABA has other effects because we have a limited number of neurotransmitters, things that can send signals from one nerve to another, and they do different things in different parts of the body. So GABA also regulates motor neurons by decreasing their activity. So it calms them down. Calmo, like, they channel Patrice as well. So if you have low levels of GABA, what's going to happen? They're going to fire continuously, right? And then so your muscles are going to contract, and you're going to be anxious AF. And those are the main symptoms of stiff person syndrome. And the thing is
anxiety?
Yes, anxiety and muscle stiffness.
Doesn't it kind of resemble Parkinson's?
It can. It can be
early.
Misdiagnosed as that. It's hard to diagnose it. It's a clinical diagnosis. You can do what they call electromyography or an EMG. And then what you'll look for is findings typical in people with this, which will be muscles that are firing for no reason. In like Lou Gehrig's disease, which is the opposite, where you have floppy muscles, you'll see fasciculation and stuff, where the muscles are trying to just, generate some sort of signal, but they're not getting anything. So they'll look for this. And then, on the list of things would be Parkinson's disease, multiple sclerosis, fibromyalgia, psychosomatic illness, phobias, stuff like that.
So she's anxious and
stiff, right?
Stiff. Oh, that's terrible.
Yep.
I hate that for her.
So you can try steroids because it's autoimmune. There might be some biologics coming down the pike that you might be able to use. Plasmapheresis, where you just, you take your blood out and cleanse it of antibodies and then put it back in your body, stuff like that. I did find a novel approach to the treatment of stiff person syndrome using Botox. So you get your Botox.
I'm telling you, man, it's good for everything.
Seems like a Band-Aid approach.
Yes, it would be a Band-Aid.
Yeah, and where are you going to put the Botox?
So first-line treatment
everywhere.
suggested benzodiazepines, anxiolytics, right?
Sure, because what you want to do is flood the body. And this is, by the way, we've talked about this in the past, that the best muscle spasm medicine after you've tried all the other stuff is diazepam, Valium.
Yeah.
Now we know why. Because that GABA reflex or the GABA pathway is involved in muscle relaxation as well as anti-anxiety. Isn't that interesting? It's also good for vertigo, too. If you have refractory vertigo, diazepam's number one choice after you've tried everything else.
Okay.
All right?
Okay.
So if you have neurogenic vertigo from somebody with a brain tumor in the wrong pathway, you could give them diazepam, and a lot of times that'll take care of it.
Interesting. I'll
At
take
least it'll
that.
make it better.
And then cardiophylexics. Last question: does he have it?
Yeah, he does not have it.
Not just based on his question, not based on the way
because
he
I have examined
asked the
him
question.
in real life, and he does not have it.
Based on his delivery of the question.
Yeah, but based on where's your microphone?
I don't know.
Oh,
You got me
that's
thinking
over
about
his
it.
shoulder.
That's right. It's over his shoulder.
He slung it
it's
over
for
his
that
shoulder.
for your third leg, your hind leg. Anyway. That was, do you remember, what was that guy's name? The weird guy that used to be on David Letterman? That weird guy, and he was older guy. And they
He
would go to him.
died.
Yeah,
Yeah.
do you remember his name? But
No.
I remember he said, man does not hear through his ears.
Oh, that's a good topic for a next show.
Man hears through his hind leg.
So, he was a very strange dude. Anyway.
Bone conduction versus air conduction. Let's talk about that next time.
Bring a tuning fork. Do you have one?
Yeah, I think I have one.
Okay, bring a tuning fork
Yeah.
and we'll do it.
Let's do it next time.
Yeah, we'll do it on Tacie.
Come.
All right, sounds good. All right, my friends. Thanks always. Go to Dr. Scott. Check him out at simplyherbals.net.
Yep.
Thanks to everyone who's made the show happen over the years. Thanks for the people that hang out with us on YouTube. We're going to try to have more of a YouTube presence going forward. I don't know what we're going to do, but it's going to be different and it's going to be a lot bigger. And it may be separate from this. I don't know. I'm working with some people on this.
Cool.
So
fun.
I have some ideas, and I'd like to do something a little bit more out there. And when I finally retire, I'm telling you, some shit's going to be said.
Shit's going to be said.
Oh, I'm so
Here we go.
excited.
Yeah,
Okay.
Dr. Steve Unbound. And so I just need to live long enough to retire. I've got a lot of shit to say, and there's going to be people who aren't going to like it, but that's just, what can I do?
It's exciting.
Yeah, that is exciting.
Wonder where that came from.
I'm just going to keep living here until you resign.
Something
until
by
you
God
retire.
will be said.
Maybe he's going to say it to you, Scott.
That's what happens when we sit up here in the studio by ourselves and just talk.
Yeah.
I poke him with a stick.
Tacie,
Oh, shit's going to be said to me.
yeah, that's right. See,
I've been threatened with that before.
we always have. How did that happen the first time? That was the funniest damn thing.
You
though.
said if
I said if they do this again, something.
no, you said if I don't get any tonight, shit'll be said.
Oh,
I
is that
said,
what it was?
ooh, you gonna say something?
Hey, Kush just came through.
And I laughed my ass off, and we have laughed about that. So that's sort of a thing in our relationship is, if there's something going on, I said, by God, something's going to be said.
Hey, Kush got it. Larry Bud Millman.
Thank you.
Yes,
no, it
thank
wasn't
you.
Larry Bud Melman.
Calvin
Melman.
DeForest.
Calvin DeForest.
Also known as Larry Bud.
No, that was Larry Bud Melman.
Yeah.
That's not the guy.
That's not the guy?
No. This guy was like an old German guy. Larry Bud Melman was hilarious.
Yeah, Larry Bud Melman's great.
But that wasn't who it was.
Okay, I don't know who you're talking about either then.
I remember Larry Bud Melman.
And he had big bushy eyebrows.
Dick
and
Assman?
No, Dick Assman. No.
Who's that?
That's one of your fans.
I wish.
That's your boyfriend.
I wish. Is he married? My demographic is single.
Hope he is, yes. Hope he is.
All right. Well, let's get the hell out of here. Go to our
Okay.
website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thank God.
Thank
Goodbye.
you. Bye.